has other equally important matters to attend to. That's why SEC designated ASEC Reservera to do the press briefing for this afternoon. So ASEC will be providing updates on the 7th Interagency Task Force meeting held earlier this morning. Thank you.
Good afternoon, everybody. For the DOH updates on the 7th Interagency Task Force meeting, the Interagency Task Force on Emerging Infectious Diseases, headed by the Department of Health, convened for its 7th meeting to discuss updates and recommendations on the management of COVID-19 health event. The IATF resolved to adopt a repatriation plan for the return of the overseas Filipinos aboard the MV Diamond Princess cruise ship. DOH is currently in close coordination with the IATF member agencies, the World Health Organization, the Philippine Embassy in Japan, and Magsaysay Maritime Corporation for the repatriation of around 460 to 480 Filipinos abroad the cruise ship who requested assistance to return to the Philippines. Among the salient points of the approved repatriation plan are the respective responsibilities of DOH, DILG, Magsaysay Maritime Corporation, Overseas Workers Welfare Administration or OWA, and the concerned local government units. DOH shall provide health human resources and their transportation to the quarantine site, on-site medical needs of the repatriates, hospitalization expenses through our PhilHealth, and personal protective equipment for the first 5 days of the quarantine period. On the other hand, Magsaysay Maritime Corporation will bear the cost of all transportation of expenses of the repatriates from Japan until completion of the quarantine period. PPE for the remaining period of the quarantine period, food, lodging, personal hygiene kits, and disinfectants, waste disposal services, and other incidental expenses of the repatriated crew. The Department of Transportation, on the other hand, will shoulder the transportation of repatriates from Haribon Airport to New Clark City, while the OWA will provide livelihood packages to the repatriates and their transportation from Manila to their respective destinations after the quarantine period. The IATF also resolved to designate the New Clark City in Capac-Tarlac as the quarantine facility for the returning overseas Filipinos. Bases Conversion Development Authority has graciously agreed to once again lend their facilities for the quarantine. They will allow us to use other buildings in the facility to accommodate the number of repatriates and have committed to augment the number of personnel who will support operations, our Health Secretary said. We would like to assure Filipinos abroad that our government is working tirelessly to ensure that no Filipino gets left behind in our fight against COVID-19. DOH and the Philippine government are prepared to undertake all measures to care for our kababayans, no matter where they are, the Health Secretary assured. Updates on our repatriates. On February 22, DOH is set to conduct a send-off ceremony for the 30 repatriates and 19 crew members of the New Clark City Quarantine Facility, which marks the completion of the quarantine period, 14-day quarantine for our Wuhan repatriates. All the quarantined individuals have not shown any signs and symptoms like fever, cough, or sore throat during their 14-day stay. They will now be allowed to go back to their respective homes and places. We are glad that our repatriates are all well and safe from COVID-19. Our repatriation mission is not possible without the dedication and cooperation of the entire Interagency Task Force for Emerging Infectious Diseases, with all its member agencies. We are extremely grateful for the collective effort of the government, concluded our Secretary.
Thank you, ASEC. So for the interest of time, we will only be entertaining 5 questions from the press. Yes po, ma'am.
Ma'am, Tina Panganiban Perez from GMA. Ma'am, can you walk us through the repatriation process? Okay, guys. Close the process.
Ma'am, can you walk us through the repatriation process? Can you give us details like ano yung sasakyan, what time sila alis, are they going to be wearing hazmats or what, for the Filipinos on board the cruise ship?
Yes, ma'am. First, I just like to tell everybody, we cannot divulge the time. No? So, hindi po kami magbibigay sa inyo ng kung anong oras po, saktong oras. Basta we all know that they will be repatriated and they will be arriving on February 23. Second, the same protocols as what we have implemented doon po sa ating Wuhan repatriation, yun din po ang gagawin natin sa ating pag-repatriate sa ating mga kababayan galing sa MV Diamond Princess. So pag ngayon po, sa ngayon, no, they are already conducting this testing na ating napagkasunduan na kailangan lahat po ng ating repatriates ay negative for COVID-19. So they are now currently conducting this test for all of these crew members and the additional passengers that would be included. Pagkatapos po nun, bago po sila i-disembark sa barko, isa-isa po rin silang i-assess ng ating medical teams. No? May medical teams po tayong mga kasama na mag-a-assess kung sila ay may simptomas o wala, kung meron silang ipinapakitang simptomas na related sa COVID-19. At gaya po ng ating pinag-usapan at kasunduan namin na wala hong sasama sa repatriation na may mga simptomas. Pagkatapos po nun, they are ready to disembark. Meron po tayong mga sasakyan na magdadala sa kanila dun sa airport sa Japan, coordinated no, by the Department of Foreign Affairs, of course, our Philippine Embassy sa Japan, and the government of Japan. Pagkatapos sila ay sasakay sa aeroplano, this would be 2 carriers, 3 hours apart. And mayroon tayong medical team sa loob ng aeroplano, and our crew and our medical teams are going to wear our hazmat, no? Yung suit natin for us to be assured na protektado rin ang ating mga crew and our medical teams. Kung sakasakaling dumating dun sa time, no, within that time period na nakasakay sila sa aeroplano na magkakaroon tayo ng crew or passenger na may sintomas, meron po tayong pwesto dun sa aeroplano na pwede natin silang i-isolate, no? Nag-request na tayo ng mga engineering controls, ang tawag nila, para meron tayong a little parang isolation or isolated area in the carrier that we are going to use. Pagdating nila dito sa Pilipinas, sila uli ay pagbaba nila, i-check po sila uli isa-isa, no, ng ating Bureau of Quarantine as well as our medical teams para tignan kung sino sa kanila ang nag-exhibit ng signs and symptoms. Once they arrive here in Haribon Airport, meron na po tayong ready mga bus, no, na ipoprovide po ng Department of Transportation. Sila po ay dadalhin ngayon sa ating new Clark City na yun na po ang quarantine facility nila. Pagdating nila doon, sila na ay may mga assigned rooms. They would be led to their rooms, and then usual po na process, parang dun sa Wuhan repatriates natin, meron silang twice a day monitoring for any signs and symptoms, and there would be regular monitoring, of course, for the test that has to be done for COVID-19.
Next question.
Ma'am, with the reported decline in the number of new cases of the novel coronavirus and the rise in the recovery status of the patients, can we predict right now to what direction will the epidemic go? I mean, do we see a progress in containing the virus, or are we in for a grim situation ahead of us? What's the global and the local status of the virus?
Yes, ma'am. Actually, globally, nakikita po natin, no, sinasabi naman dun sa mga datos na nakikita natin sa ibang bansa, na even in China, no, na sinasabi nila bumababa na yung per day nila na bilang ng mga datos ng mga nagkakaroon ng COVID-19. Pero ang even WHO ang nagsasabi rin po sa atin na isa sa nakikita nilang obserbasyon ay maganda ang naging response ng lahat ng bansa, no, na apektado dito sa nangyayari sa COVID-19 situation. And they can see improvements comparing to the other response na nangyayari, no, in the past pandemics. Pero sa ngayon, wala pa kong makakapagsabi, no, kung tayo ay matatapos na, kung tayo are headed na tayo na matatapos na yung pandemic na meron tayo, kung green ba yung future sa atin, or meron na ba tayong hope na we can all para bang relax and say na okay na talaga at ang mga numero ay bababa in the coming days. Wala pa akong makakapagsabi. Alam po nating lahat with with our daily updates na wala pa akong certainty hanggang sa ngayon ang ating mga ebidensya na nakakalap for science to know really exactly mode of transmission, incubation period, lahat po ng ito ang ginagamit lang natin ay yung base sa obserbasyon ng mga kasong meron tayo sa ngayon. Kaya meron tayong mga working definitions, meron tayong mga working number of days for incubation period, but nothing definite yet. So we still need more time para makalkula lahat ng ito para magkaroon tayo ng definite answer. So ngayon po, hindi pa natin masasabi, hindi po natin masasagot. Yan pong katanungan nyo yan.
Sir Ra.
Ma'am, ano pong mangyayari dun sa 41 or 40? First of all, how many are there? There's 44 who are infected and they're all flu members. Tama po, ma'am?
Actually, we received word this morning na meron na po tayong 52 na positive cases for COVID-19 but still verifying pa po kami. So yesterday it was 44 and yung 44 na yun may isa pong gumaling na at na-discharge sa ospital. So we have 43 kahapon po. Kaninang umaga meron pong report na pumasok 52 daw, 8 ang bago pero still verifying pa po kami.
Okay, what will happen to them, ma'am? If some of them want to go home but they cannot, ano po ang plans ng government? Will they also be repatriated the way these other two members were repatriated?
Pag-uusapan po uli yan sa Interagency Task Force. But as we have heard from the President and even our Secretary, nasabi lagi, no Filipino, o wala tayong kababayan na iiwanan, we will not be leaving them behind. So pag-uusapan titignan natin logistics-wise and also kung paano natin sila maiuwi ng maayos because we have to consider also, ito pong 52, kung sakali mang verified na itong ating numero na ito, hindi po yan sabay-sabay na pumasok sa ospital. So kung sakasakaling gagaling sila at magre-resolve po ang kanilang mga sakit, maaring hindi rin sila sabay-sabay na ma-discharge. So kailangan ho nating pagplanuhan maigi, paano natin sila maiuwi at paano natin sila ma-accommodate pagdating po nila dito.
So last question, ma'am. 30 and 460 to 480, that's a big difference. So gaano po karami yung itatalaga ninyong medical teams for the planes and how many, logistics-wise, ilan po ba gaano karami siya? How different is this now?
Well, it is parang napakalaking diferensya po. That's why yung proseso namin, yung pagpaplano namin really has para bang nag-take ng medyo matagal, no? We plan for properly for this considering yung pong numero nila. So medical teams as na-mobilize na po sila. Meron po tayong mga medical teams na mauuna dun sa Japan na para lang po samahan sila dun sa bus, manggagaling dun sa ship, papunta sa airport, and also they would be part of the teams to assist our passengers na doon sa ating carrier. Meron din po tayong diferensya sa number of hospitals na kailangan natin immobilize. Kung dati po ang referral hospital natin ay isa o dalawa lang, ngayon po we are mobilizing around 16 hospitals of government which are nearby so that pwede po natin silang pagdala ng ating mga pasyente kung sakaling merong magkaroon ng simptomas pagdating dito. We also have pre-positioned and also planned for PPEs ng ating mga medical workers. So alam po natin that we are now mobilizing 5 hospitals to provide medical teams. So ito pong mga ito ay ating na-compute per day kung ilang PPEs ang kailangan ng bawat medical team and we are counting 14 days. So ang laki po nung mga pangangailangan natin dito, logistical requirement, and this is really a big difference comparing with the Wuhan experience.
Sir, and then Ms. Shi.
Yung 460 to 480 natin na repatriates, at baka meron na po kayong data kung anong age range nito. At ano po mangyayari dun sa may iwan, yung at least siguro another 60. At anong plan ng government sa kanila? Saan sila i-house sa Japan?
Sir, ang ating kwentahan ng numero, we had an initial 538 Filipinos. Ngayon, minaminus po natin dyan yung ating mga kababayan na nag-positive sa COVID-19. So, nung sinubtract po natin dyan yung 52, kung mabe-verify natin, lalabas po na 486 ang numbers. Pero iniisip po natin na meron pa po tayong proseso na pag-a-assess ng mga tao bago sila bumaba or mag-disembark. Some of them may exhibit signs and symptoms during the time that we are about to disembark. Meron pala. Or meron po tayong ginagawang testing ngayon, yung sinasabi natin na matetest lahat ng mga tao na baka meron pa rin magpositibo. Kaya binibigyan lang namin ng range ngayon. Ayaw pa po namin magbigay ng exact na number for now. But definitely, pagdating po ng February 23, makukuha po natin yung exact number after all the processes has been accomplished. As to the age range po, we do not have specific details for now because it's with the Department of Foreign Affairs.
Napag-usapan din ba sa IATF kung ano yung gagawin para dun sa mga crew members if ever na magkaroon na ng flights going back to Hong Kong and Macau? Kasi since na partially lift na yung travel ban and pwede na bumalik yung mga OFWs natin dito sa regions na to, ano yung plano ng IATF para sa mga crew members?
Well, as long as they will finish their quarantine period, they will be cleared and given a good bill of health. I don't see any reason kung bakit hindi sila pwedeng bumalik para magtrabaho dun sa kanilang lugar. So, hindi po yan naka-agenda dun sa IATF natin because I think carried naman po yan based on our guidelines ay makakapag-qualify sila kung sakaling makatapos na po sila ng kanilang quarantine period and they have already been monitored for 2 weeks after that.
Ma'am, last 2 questions na lang po.
Yung pinatatanong lang nung desk namin, may mga nagtatanong pa sa Twitter, like an OFW from Singapore, bakit daw walang mandatory, or OFW I think from Hong Kong ito, but yung mga galing Singapore daw, wala namang mandatory 14-day quarantine when Singapore has more cases than Hong Kong. So parang nagre-reklamo, I guess, yung iba kung bakit magkaiba yung pagtrato dun sa mga OFW galing sa Hong Kong and Singapore, and paano naman daw kasi sila na kailangan maghanap buhay.
Okay, ma'am. Napag-usapan niya sa Interagency Task Force. Ang sinasabi nga natin, tayo ay bumuo nitong criteria para masabi natin kung ano-ano ang mga bansa na kailangan ng restriction at ano yung mga bansa na pwede pa naman na hindi sa ngayon. No? At ang sinasabi lagi ng Interagency Task Force, unang-una, kasama ang China, kasama niya ang Special Administrative Regions niya. That's the first reason kung bakit kasama natin ang Hong Kong at Macau. At yung umpisa pa lang natin ang response natin, kasama na sila. Ngayon, for these other countries with local transmission, pinag-aaralan na po lahat yan sa ngayon. Meron po tayong ginagamit na template or matrix kung saan tinitignan natin ang iba't ibang factors or criteria for us to determine as much as possible scientifically kung bakit tayo nagre-restrict, like volume of passengers na dumadating sa bansa, yung burden of infection dun sa country na yon, and other relevant criteria na ginagamit natin. So, hindi po natin sinasabi na ngayon ay ito na lang talagang mga bansa na ito ang binibigyan natin ng restrictions and in the future hindi na. As I've said, it's evolving. Ang gusto ng Interagency Task Force, every 3 days or as much as they meet every week, mapag-usapan itong criteria na ito, mapag-usapan din yung mga bansang kailangan isama or yung mga bansang kailangan i-lift na yung ban. So, everything is evolving, wala pong permanente dito.
Last question. Yes, ma'am. Second, regarding lang po dun sa health personnel who will be joining them sa flight. Last time kasi dun sa 30, we have 5 from DOH. But now may clear number na po ba? And yung sa NCC, they will be exiting on Saturday po. It's their 14th day, tama po. And how will be the manning naman, health personnel that will be manning dun sa 500 from 16? Secretary said yesterday, it's composed of teams from hospitals na may 10 na tao. So, paano po yun?
So, ganun pa rin, yung sinabi ni Secretary, yung plano naman na yun ay napapasta na since yesterday. So, we have mobilized our hospitals to provide for medical teams. So, meron po tayong teams na magmaman dun sa ating quarantine facility, 5 medical teams composed of these personnel from these hospitals that we have identified. So, yun pong ating mga kababayan na nakatapos na ng kanilang matatapos na ng kanilang quarantine period tomorrow, yung kung galing sa Wuhan, they are all well. Meron po silang send off na para bukas, no, sa kanila at uuwi na sila sa kanilang mga areas. Yun pong ating mga medical teams ay manggagaling doon sa 16 hospitals na na-identify po natin at sila po ay 14 days din na magpapalit-palitan para makapagbantay dito po sa ating mga kababayan.
How many teams will be assigned per day?
At the outset, doon po sa pinag-usapan kanina sa IATF, we have 5 medical teams. No? These 5 medical teams will be the proportion. Ito na lang po. The proportion is 1 medical team per 100 persons. Okay, so we have 5 medical teams in a day. Okay, composed of these 10 persons that we talk about. Ang ginagawa po ng medical teams natin, dito po sa quarantine facility natin, they monitor of course. We have telephones, we have text messages, and then when there are really symptoms, no, na kailangan i-manage, pinupuntahan, no, kung napupunta sa ating mga designated areas, yung itong ating mga persons under quarantine.
Thank you very much. That ends our press con for today. Thank you very much po for participating.
Ilang member each team?